So I'll start by placing some ointment into your ears, okay? So I'll just start on this side. Okay. And just give it a little mix. And then I'll do the same on this side, okay? Just a little bit of ear cleaning ointment. Okay. So just take a moment to allow for that ointment to work. And you might hear a little bubbling sound. That's quite normal and quite natural. It's a positive indication that the ear canal is clearing and that all of that pesky earwax is starting to dissolve gently so that I can go in and do a proper, thorough ear cleaning for you, okay? Bubble, 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 bubble. Okay. Good. So, I understand that tonight we're going to be doing a thorough earwax removal for you. But first, now that I have applied some cleaning ointment, I'm going to very gently take a look inside your ears with my otoscope, okay? And the reason for that is I want to make sure that alongside the earwax that you have in your ears that's causing some challenges for you, that there are no infections in the ears and no other signs of inflammation or any issues that I should be concerned about, okay? Alright, so I'm going to be using my otoscope, okay? This is a new clean tip that I have put on especially for you. Hygiene is of utmost importance here at our clinic. So, if you hold nice and still for me, I promise you it won't be painful, and I'm just going to have a little look carefully inside your ear. Alright, so let's just see here. I see. So let's check. So I'm just having a look at the health of the eardrum. And it appears nice and healthy. I'm not seeing any signs of a perforation in the eardrum. And I'm also, let's just see here, hang on. also not seeing any obvious signs of infection. So let's just take a look here. Okay. Yeah, so there is clear signs of earwax that's become impacted in the ear. Okay, so that will be quite easy and straightforward to resolve for you, I believe, with a thorough cleaning. So the ointment that I've already applied in your ear is already doing its work, helping to dissolve the earwax. So rest assured, you're in the right place. Okay. Okay. Good. So I'm just going to put on a new little end, okay, for the other ear. Now, I imagine that this side will be similar, but it's always good to check because you can get ear infections in one ear, and I just want to make sure that that's ruled out in terms of what we're treating tonight. Okay, all right, so I'm going to just come a little closer. You did really, really well with the last one, so let's keep up the good work. Okay, so just carefully coming into the ear. Shouldn't be any discomfort at all. You're doing okay? Alright, good. Okay, so let's see here. So I can see that on this side the eardrum is healthy. Okay. No signs of infection. So as before, with the other ear, there is some indication here of inflammation, but I believe that that is a result of the impacted wax in the ear. So I'm not too concerned because I think that once we've cleaned the ears, that inflammation will naturally dissipate, and the ear cleaning solution that has already been applied will also have a positive antiseptic, anti-inflammatory effect. Alright, okay. So I'm not seeing any issues here other than some impacted earwax, and that should be quite easy to resolve. Okay. Alright, okay. Very good. So I'm going to apply some antiseptic around the outside of the ear, okay, before I go in with my little scraper. So I'm going to be using a little cotton wool ball like this, and I'm just applying a few little drops of antiseptic onto the little cotton wool swab. Okay. And then I'm just going to very gently move your hair out of the way and wipe around the outside of your ear. Okay. All right. Okay. Let me do the other side. So just a few little drops. 1, 2, 3, 4. Okay. And just ever so gently going to dab this around the outside of your ear, okay? Now this is really just a precaution because we don't want to introduce any germs or any bacteria or any microscopic pieces of dust from the outside of the ear into the ear canal, because we are obviously going to be treating the ear canal, and anything that goes into the ear could potentially have a negative effect on the eardrum, and of course we want to protect the eardrum as much as we can. Yeah, all right, okay. So the first thing I'm going to do is I'm going to use my little ear pick, okay, and I'm going to be using this to scrape out some of that impacted earwax in your ears, okay? So just using a very gentle little scrapey scrape motion, and it may or may not have an interesting sound, okay? But please don't be alarmed. I promise that it will be very gentle and there won't be any discomfort at all. Okay? Alright, so if you'd like to just hold nice and still for me, I'm just gently going to start here on your right hand side. Just ever so gently do a little bit of scraping. So the ear cleaning ointment that I applied has now softened that earwax nicely. So it does make it quite easy to extract, particularly in this way. Okay, so just do a little bit of cleaning of the tool. Okay, and we'll do the other side. You again just let me know if there's any sensations that feel uncomfortable or anything, okay? So I'm just very carefully coming to this ear now. And there we go. Just doing a little bit of a scrapey, scrape, scrape. There we go. Okay. It is a very delicate operation, and it does take some practice, of course, as with anything like this, but it's a very satisfying process. And the most satisfying part of all of it is being able to help and seeing my patients' faces light up once their ears feel so much better and they don't have any issues with their hearing. Okay, so let's see a little bit more here on this side a bit. Okay, so the next thing I'm going to do is I'm going to go in with a different sort of ear pick. Okay, I'm going to be using this little tool. So it's very fine. Okay, and I'm going to go in and do a little bit more scraping in your ears. Okay, that's just to make sure that I'm getting all of that dissolved, or I should say softened earwax that was impacted further down into the ear canal. Okay, alright, so let's come a little closer, if that's okay, with my tool here, and just do a little bit of a scrape. So this part is a very, very delicate operation, and it does require some precision. So just being careful here. Are you doing okay? There we go. I think that we're almost done here. On this side anyway. Okay, alright, okay. Right, so that was effective. So let's do the other side, okay? So I'm just going to go in with my little tool. Just very, very carefully come a little bit closer to you. Okay. So you may find with an ear cleaning that one side is always a little worse off than the other. The main reason for that being that if we sleep on our side, then this is the side that we prefer. So we tend to get more wax buildup. There are other factors that come into play. For example, if you wear headphones, then that can also result in more wax buildup than usual. And of course, if you do happen to sleep with headphones in your ears, then that can cause some irritation and can lead to a buildup of your wax. Okay. Good. Okay. All right. So let's give my tool a little clean here. Okay. So how's that feeling? A little bit tender. Well, that's to be expected after an ear cleaning like this. I'm going to apply some more antiseptic solution around the outside of your ears now that the ear cleaning is complete, okay? Okay. So just a few little drops. Okay. Good. Just a few little areas here that need a little bit of attention. So. Okay. And of course this side as well, just a bit of TLC. Okay. So I'm going to have another look inside your ears with my otoscope. Okay. Okay. So just hold nice and still for me. I just want to make sure that everything has been cleared as it should and that everything is looking healthy. Okay, and there's no further signs of impacted wax that perhaps I didn't get with ear scraping. Okay. So that's looking so much better. Okay. Let's do the other side. So just coming a little closer. Just taking a look into the ear now, into the ear canal. Okay. Alright. So okay. Alright, good. So that concludes your earwax removal and ear cleaning. I trust that your ears are feeling a whole lot better. Good. Well, it's always a pleasure to see you. Do take care of yourself now, okay? And get some good rest. Look after yourself. Look after your ears. And thank you for coming to see me. I will see you again soon, okay? Take good care now.